I'm Melissa Russum with Northern Rivers Family Services. For the latest episode in our ongoing series, Conversations with Colleagues, I sat down with Dr. Christopher Burky, Medical Director at Northeast Parent and Child Society, and Dr. Virginia Khoury, Medical Director at Parsons Child and Family Center, to talk about the state of mental health care in the United States. We discussed barriers that can prevent individuals from receiving much-needed services, the effects of the Affordable Care Act, as well as increasing diagnoses of common behavioral health disorders like ADHD and much more. Let's see what the doctors had to say. So, Dr. Burky and Dr. Khoury, following national tragedies like the shootings in Sandy Hook, the shootings in Aurora, there are a lot of calls for increased mental health services. There's people saying that really the services that are available are inadequate in certain ways. Would you agree, Dr. Burky, that there is sort of room for improvement, or that there are needs that aren't currently being met under our current mental health system?
I think that's definitely true. I think accessibility to mental health care remains a real problem. Availability of providers in particular is very difficult, and even where there are providers, it can be very difficult for patients and families to access services. That's a huge problem that needs to be addressed.
Dr. Khoury, would you say that, for some families that do prevent them from receiving the services that they need?
Well, there are sometimes almost innumerable barriers. I think one of the initial barriers is just having the capacity to identify children and adolescents, and even adults that may be in need of mental health assistance. Then you run into the problems with who has healthcare insurance and who does not. I think Obama's Affordable Care Act is attempting actually to address one of that specific barrier to care. Then once a person has been identified, does have insurance or some means to pay, finding an available provider with time and ability to take on a new patient and to provide the type of treatment that particular patient might need. That is very, very difficult. There's a shortage of psychiatrists, and most especially, there is a severe to extreme shortage of child and adolescent psychiatrists. There are only, about 5,000 of us in the entire United States of America.
Wow.
That's it. And you've got two of them sitting right here talking to you. There are really very few of us, very few training programs. Some of those programs don't even go filled. And so rolling that backwards, you run into the problem of how are medical schools teaching and training psychiatry, how are the residencies preparing, or what are the available residencies, and how are the residencies attracting good people, qualified people that can fill those future positions. And that even goes to insurance reimbursement for psychiatry services. For example, if I graduate from medical school with a $200,000 debt, but I know that if I go into psychiatry, I will make relatively little money compared to gastroenterology, where I'll make plenty of money, easily able to pay those debts off, it might really influence my decision about what type of future I envision for myself. Mm-hmm. So there are many, many barriers, and one of the biggest of all that I think no kind of law or act is really going to cover or fix is the stigma of seeking mental health assistance and what that means.
Right. So as far as that stigma, is it more acceptable for people to say, I need help?
I think we are. I think the idea of having mental health problems is becoming more mainstream and more acceptable to the general population, as well as professionals, frankly. But there's still a long way to go. I think we're also getting better at identifying people with mental health issues earlier. But really, there is still a problem with being able to get past the stigma and really say, I need some help.
And are there certain things that, that any of us can do to open up those conversations?
Well, in a way, what has, for example, just happened with the Newtown shootings and even, any type of tragedy, horrible tragedy like that, is it does actually highlight the need for mental health counseling. The trouble or identification, I think that there is very, very little doubt that there was something horribly wrong with the individual who committed that atrocity in Newtown. Terribly wrong. How could that individual have been identified? So it highlights the need, highlights the awareness. What happens then is a lot of people become fearful. They don't want to be identified as some kind of crazy murderer. And the types of things that don't help are things that just came out. For example, there was a report the other day that a bunch of different groups ranging from the National Rifle Association to the Scientologists were actually blaming psychiatry, saying that it was psychiatrists and the drugs that they used that were really actually causing people to do things like kill children in Newtown.
Wow.
So those things don't help. I think on the positive aspect, there's been a renewed emphasis on no tolerance, zero tolerance for bullying. That actually, those things help, because one of the stigmas is if you sort of come out that you are a person getting mental health assistance, it's very easy to be stigmatized and bullied. Stigmatization is a form of bullying. So, yeah, I think that both good and bad.
Right. Now you had mentioned psychiatrists can go under a lot of fire for prescribing medications. Is that still hotly debated?
Oh, absolutely, especially the children.
Yes.
There are so few medications that are actually FDA approved for children, but are commonly used and acceptably used. But just the general idea of medicating children is a huge issue, and not generally accepted within the lay population or the medical profession, for that matter.
Mm.
So it's definitely a huge problem.
Have either of you seen benefits to witness the benefits that medications can have?
Absolutely.
Sure.
Absolutely.
Yeah, absolutely. I think that we as child psychiatrists, we do not see a child and go, here's a pill,
Right.
you'll be all better now. We hold no illusions, and that is actually unethical treatment. So we are the first people to be proponents of doing the additional work that needs to be done with the child and families. And to be honest with you, sometimes the barriers to care that exist actually derive from the insurance companies, who may say, well, you've reached your max of 20 sessions a year, and now you have to pay fully out of pocket, but your medication management sessions will continue to cover those. So, but to us, the true care, prescribing is just it's a tool. It is just a tool to help people do some of the very difficult work they have to do in a more rational, perhaps facilitated way. It's not a substitute for counseling or other supports that the child might need, and certainly no substitute for the family work that might need to be done. And we're the first people to say that, but often the first people to sort of get panned for all we want to do is shove pills down people's throat. Nothing could be farther from the truth.
Right. Does mental health really get the same treatment or adequate treatment as treating physical health problems? Is there respect from insurance companies, from government, for providing mental health services that's on par with treating physical disease?
I don't think so.
I don't think so.
I feel a little like Rodney Dangerfield. We don't get no respect. But I think actually laws have changed. But parity, they actually had to legislate parity laws to give mental health equal reimbursement for as under healthcare insurance. So and however much has been legislated, that is just in the very beginning phases of being able to be actualized. And hopefully under the Affordable Care Act, a lot more and I think better access to services can actually take place. That's the
Yeah.
intention of affordable care, is my understanding.
I think just the fact that we have to legislate access to care for mental health problems
Right.
is telling about where this nation is as far as looking at the stigma attached to mental health. We know from ongoing research that many of the diagnoses that we treat actually do have a neurologic basis, a biologic basis to them. We're getting more and more evidence that that's the case. Yet we don't treat these like medical problems when it comes to getting access and reimbursement to providers. There are unbelievable limits that are placed on physicians as well as clinicians that really are, I think, based in the stigma that somehow that patient shouldn't receive the level of care, the access to care that say a cardiology patient might need.
Now, with those barriers that often could either possibly prevent, does it even prevent a patient possibly from even being able to get an appointment with a qualified psychiatrist sometimes?
Of course.
So with that being the case, do primary care physicians, have they sort of assumed any of these, sort of taken on some of the initial roles
Oh yeah.
of that?
Yes.
Not always by
Yes.
choice, but
Right.
it's the reality. I think better than 70% of mental health is actually treated at the level of primary care.
Wow.
So they're definitely on the front lines of identifying patients in need and providing care. And again, a lot of that ties back to the fact that they can't get access to make a referral to a mental health professional, so they feel stuck.
Going back to shortage and
feeling like
everything else.
and feeling like they need to do something to help their patient, and puts them in the position of providing care outside of their area of practice.
Right.
And I think actually one of the biggest trends in medicine right now is the idea, and I think you've been involved in hometown health with
Definitely.
this type of thing, is the trend toward basically creating the concept of health homes, which integrate primary care with mental health treatment as part of the same practice. And that's going to actually probably really change the role of psychiatry, because psychiatrists, being relatively in shortage as they are going to be more in positions of team advisors and team supporters and troubleshooters, as opposed to being the front line providing this service after service after service, which would completely deluge and consume and be unsupportable with the level of psychiatrists that you have. But psychiatrists as part of a primary care treatment team, boy, you can really get a lot of mileage out of that, and a lot more people would be able to have access in an integrated setting, which would probably also help reduce stigma.
Yeah, there's definitely a national trend toward integration of mental health care into primary care settings, and the opposite, integrating primary care into mental health clinics. And it really gets down to bringing the care to where people are in order to help improve access. The Affordable Care Act gets at that a little bit, looking at ways to develop community provision of care, in providing care in schools, as well as integration of care into primary care.
I think one thing that I know Chris still works extensively in a child guidance clinic, and I have spent many years, we all do, working in various clinical settings. One issue is that even once a person or a family may be identified and in treatment, it's very hard to sustain that momentum. A lot of people just function from crisis to crisis. Clinics are set on a schedule on weekdays, and you're not set up for crisis response. So it is possible that a primary care setting integrated with a psychiatric clinical setting could really actually sort of help people more directly in the ways that they function, in the ways that they are. Because sometimes people just have enough strength to get treatment when they really have to get it. They don't have the ability to do a long-term, week after week, month after month commitment. So, there's a lot of different ways that we can do things. We just haven't always been very good at meeting people at the level at which they need to be met to be served.
And studies of these approaches really do show that it's much more effective and economical. Studies done in adult populations receiving care for depression in their primary care setting show improved compliance with their mental health treatment. They also show improvements in their medical care, decreased utilization of emergency rooms for crisis. So there's a lot of benefits that are possible if this really becomes a widespread way to provide mental health care.
Mm-hmm. And I think that research also supports that because actually mental health, not going to say that mental health problems directly kill you, but they actually are associated with a lot of very significant physical disease and even early death. So if you have better mental health treatment, and that's hand in glove with better primary care treatment, that I think everybody is going to win. People's health is improved, overall health, the whole person health is improved. And if you put a little bit of money in up front to set that up, you would save an enormous amount of money, because those people are not dying slow, horrible deaths in hospitals of, chronic complications of whatever. So I think really that we are finding more and more that's sort of the way to go.
Yeah.
Tell us what the Hometown Health Partnership, a little bit about sort of what that means and where we are with that.
Well, right now we're working on developing a satellite mental health clinic within the Hometown Health Center. They're a federally qualified health center, so they already had a small amount of mental health care available. But really we're finding that it was inadequate. Their providers, as we talked about before, were faced day to day with dealing with a wide range of mental health problems. Their pediatricians really say, look, 10 years ago, we used to see kids for asthma, we used to see kids for all kinds of things. But the treatments for those have become so good that we really don't have to deal with them that often. But mental health has really stepped in, and behavioral problems have really become the bread and butter of their daily practice. And they don't know how to deal with them, and they don't know how to access services for their patients. So we're in the process of putting mental health clinicians directly into their clinic. There will be therapists available, case management services, and actually I should say case coordination services, as well as access to psychiatric consultation. We've been working additionally with Alice Hospital to join in that effort to provide access to an adult consultant who will also be able to help with their patients, because they see adults in addition to kids and families.
Wow.
So it's a huge effort that's going to involve a lot of coordination between our two services, but I think when it's all said and done, we'll provide much better and more accessible care.
So what would your advice be for the parent who is wondering, gee, is this something that really is bad enough to talk about, or something that's worrisome enough to talk about, that when there's maybe something holding them back?
What do you think?
I always like to advise parents to educate yourself about your child. That's one of the first things we did in training, was learn what's normal.
Mm-hmm.
All right. Just doing that, learning, at 3 years old, this is what I can expect, will help alleviate a lot of parents' anxieties.
Mm-hmm. And pediatricians regularly incorporate what they call anticipatory guidance into their pediatric sessions. Okay, you have an 18-month-old. This is what's coming. This is what to expect. Don't forget the car seat and all that kind of stuff. So not just health, but mental health. But parents, I would hope that they would go to their pediatrician. Mm-hmm. However, one of the nice things about increased awareness, they can also go to a teacher, a guidance counselor, even church people may be able to be helpful or point you in the right direction or give you enough support. Yeah. Internet is, I think, one place kind of everybody goes to. You just have to be careful. Not every site is a good site.
Right.
look at reputable websites. The American Academy of Child and Adolescent Psychiatry. You don't have to be a member. You can go on the website. They have facts for families, for example. The American Psychological Association. I mean, go for .orgs as opposed to .coms. I think it's always safer. National Institute of Health, National Institute of Mental Health. There are wonderful, wonderful websites out there with wealth of information, all for the asking. But just be careful where you're looking, and don't always try to self-diagnose.
And those sites are really great because they're written for families. They're written for parents to pull up, to be very understandable. They're not written in scientific jargon, so they're very accessible.
Yep.
Wonderful.
Yep, New York State Office of Mental Health also
Right.
has an excellent website.
That's wonderful.
There's tons of stuff in there. So go for the .orgs, the .govs, not so much the .coms.
Perfect. Great advice for all of our parents listening. So Dr. Burky, Dr. Khoury, thank you so much for being here with us. And thank you for
Melissa.
watching.